Today, we are running through the features and functionality of the BodyWorks Eve PoCUS training simulator. Designed to meet the majority of the core ultrasound curriculum as defined by the International Federation of Emergency Medicine, including the OBGYN training requirements. Eve is an ultra-realistic mannequin, so trainees can learn to acquire images using the key landmarks to find the image windows and compensate for obstructions, just like in real life. The scans themselves are a combination of the anatomically accurate hearts from HeartWorks and the real patient scans from ScanTrainer, covering from the upper chest all the way down to the pelvis. There's no better way to learn PoCUS. BodyWorks Eve enables you to teach in two ways. For self-directed learning, we have over 100 patient cases on the system for the trainee to work through and test diagnostic skills. Organised by anatomy or protocol, trainees can work through these cases independently at their own pace. For tutor-led teaching or assessment, the active scenario mode enables tutors to use the handheld tablet to instantly change the patient's pathology, heart rate, respiratory rate, while the trainees are scanning. Let's start with self-directed learning. In the patient lists, the cases load in a randomised order. This means the order of cases will be different every time the list is run. Let's run one of the cases. Now that the simulator is loaded, you can see that the interface consists of the ultrasound fan, the clinical information, and the ultrasound control panel. Users can optimise the image using the TGC, depth, zoom, focus, sector, and gain. Once frozen, users can take measurements and annotate the image. Within the mode menu, users can find the options to turn on colour Doppler or M mode and switch between the cardiac and the curvilinear probes. Once the trainee has scanned the case, they make a diagnosis and see if they were correct by clicking Reveal Details. They then move to the next patient case in the list by clicking the Next Patient button. This loads the next patient case without leaving the software, enabling a seamless scanning experience. The other self-directed learning option is the protocols. The protocols work in exactly the same way as the patient lists, but the cases are organised by protocol. The protocols on the system are FAST, which contains 32 cases to cover the full FAST scanning protocol, Thoracic or eFAST, containing 14 cases to facilitate the whole range of extended trauma scans, Basic Cardiac or Echo in Life Support, with 8 cases demonstrating a selection of cardiorespiratory emergency scenarios, 6 cases of abdominal aortic aneurysms of varying sizes and positions, early pregnancy with a selection of 8 common obstetric cases, including intrauterine and ectopic pregnancies. Shock and resuscitation contains 4 cases highlighting the use of ultrasound for hemodynamically unstable patients. BodyWorks Eve also allows tutors to create their own patients from any of the pathologies available on the system. Tutors choose the pathology or pathologies, set the heart rate, respiratory rate, and add the patient's clinical information. These patient cases are then saved into a custom patient list, which the tutor sets as a practice or exam mode. In practice mode, the cases open in a randomised order, and trainees can click Reveal Details to check their diagnosis. In exam mode, the cases are anonymised and open in order. In active scenario mode, the tutor uses the handheld tablet to instantly change the patient's condition whilst the trainees are scanning. The tutor can control the heart rate, respiratory rate, and change the pathology by simply clicking on the anatomy and choosing from the list of pathologies. In this way, the pathologies on the system can be used in any combination, giving the tutor over 10,000 possible patient cases to use in their training. This flexibility means that the tutor can incorporate trainees' findings and responses into the scenario. For example, if trainees have correctly identified a pleural effusion and suggested a course of treatment, the tutor can reduce the severity. Or, if trainees have found one pathology but missed a second, the tutor can worsen the patient vitals and encourage the trainees to continue scanning. Tutors can also open any of their custom cases from the tablet in active scenario mode and use them in a supervised scenario. There is also the option to include the HeartWorks detailed cardiac module on the same platform and extend the learning. HeartWorks is the world's leading echo training simulator with accurate 3D anatomy, transesophageal and transthoracic scanning, sophisticated Doppler package with pulsed wave and continuous wave Doppler, and over 135 intercardiac structures labelled to aid learning. BodyWorks Eve. She's going to change the way you teach point of care ultrasound.